Namaste. Welcome back to SLG Hello Doctor, the YouTube channel that brings to you conversations with experienced healthcare experts on varied topics of health and wellness. With reports of a new variant of COVID doing the rounds, we urge you to go back to being cautious and mindful. We all know that excessive alcohol intake can lead to a plethora of liver related issues. But do you know that non-alcoholics can also develop something called fatty liver? Today, we will be talking to our guest expert, Dr. Namburi Anil Kumar, Senior Consultant Physician at SLG Hospitals, Hyderabad. Thank you, Doctor, for joining us here.
Yeah, thank you. I'm glad to meet you here.
So, Doctor, tell us what is non-alcoholic fatty liver disease? And our short form for today is NAFLD, right?
So many causes for this non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease, that is accumulation of abnormal fat in the liver parenchymal cells in people who take less alcohol or no alcohol at all. So it is the most common disease in the world. It affects 30 to 40% of the population.
So, Doctor, you said it's prevalent in 30 to 40%
Yes.
of the world population.
Yes.
So, what are the causes?
Yeah, the cause of this NAFLD is very multifactorial, just like hormonal, lifestyle and genetic. Coming to the genetic, very less common cause, and coming to the main thing is hormonal. That means it is mostly associated with the metabolic syndrome. That is like the persons who are having obesity. 40% of these obesity people will have non-alcoholic fatty liver disease. In what happens in this obesity, mostly in the people who are having abdominal fat around the abdomen will more prone to develop this disease. Around 20% of the diabetes people will also develop this problem. That means in this glucose intolerance and insulin resistance are the main causes of this one. In about 20% of the people who are having high cholesterol levels, that means increased triglyceride levels, increased LDL levels, will also develop this one. And even though people who are not obese, that means thin people also, about 3 to 30% of the people also develop this accumulation of the fat in the liver. These people will have glucose intolerance or some insulin resistance in those cases. And there are so many drugs will causes, people who are using chronic uses of the steroids, some cardiac drugs, people are using like diltiazem and amiodarone tablets, and HIV patients who are taking antiretroviral therapy, and some due to some poisons like yellow phosphorus, carbon tetrachloride, vinyl chloride poisons, and patients who are having some endocrinopathy disorders, mainly commonly some endocrinopathy disorders will have these phenomena like hypothyroidism patients will develop, or hypopituitarism patients, or PCOD disease, because PCOD disease is very common in the ladies, and high Cushing syndrome and hypo-beta lipoproteinemia. These are some of the endocrino diseases these people will develop alcoholic fatty liver disease. And for example, in patients with obese, they will develop chronic intermittent hypoxia due to obstructive sleep apnea. So these people will also develop alcoholic fatty liver disease. And sedentary lifestyles. The main problem is sedentary lifestyles. Because of the sedentary lifestyles, patient will have developing the obesity following the insulin resistance. It may lead to the fatty liver, accumulation of the fatty liver. So main thing is sedentary lifestyles and dietary habits and hormonal changes, like mainly the insulin resistance is the main culprits for causing this fatty liver.
Doctor, you said 30 to 40% of population has NAFLD. So, what are the causes behind this large-scale prevalence?
Yeah, the cause of this disease is multifactorial, mainly hormonal, lifestyle and genetics. The hormonal things are mostly associated with the metabolic syndrome, that is insulin resistance. There are 4 main categories of the people who are associated with this risk. Number 1 is obesity. 40% of the obese people will develop this fatty liver, and in these people who are having abdominal fat around the abdominal, if fat accumulation, these people will have more prone to develop this fatty liver. Number 2, hyperlipidemia. About 20% of the people who are having high triglyceride levels or high LDL levels will prone this fatty liver. Number 3 is people who are having diabetes. That means the people having glucose intolerance or insulin resistance will develop this fatty liver. Even though people who are thin, but we will also develop fatty liver about 3 to 30% of the people because of the insulin resistance in those people. There are some of the endocrine disorders also have this fatty liver development. They are mainly the common diseases like hypothyroidism and hypopituitarism, and one of the common diseases in females is PCOD, polycystic ovarian disease, and hypobeta lipoproteinemia and Cushing syndromes. And some of the drugs will also causes a little bit, but mostly who are using long-term use of some corticosteroids, some cardiac drugs like amiodarone and diltiazem, and people who are intoxicated with some of the toxins like vinyl chloride, carbon tetrachloride, and yellow phosphorus, and HIV people who are using antiretroviral therapy or more also prone for this fatty liver. One of the most important thing is excessive intake of soft drinks will also lead, and one more thing is excessive dietary consumption of the fructose related fruits consumption also will lead to this fatty liver.
Doctor, right in the beginning you said that it is pretty benign and the symptoms are not very obvious. However, there must be something that will tell us that we are heading towards fatty liver, or how does one even get to know that one has this problem?
As I said, that a patient won't have any symptoms. It is very benign. There won't be any liver damage initially. Somebody comes for the routine checkup, for the health checkup, annual checkup or any checkup. If you see that there is in the scan, there will be accumulation of the fat. There may be grade 1 or grade 2, grade 3 fatty accumulation will be there. The mainly thing is the persons who are having the risk factors, like as I said, the obesity, diabetes people who are having high cholesterol levels, or who are having insulin resistance, these are more prone for developing this fatty liver. This can be identified only through the ultrasound examination or any CT scan or MRI scan. It can be through these tests only we can identify.
Doctor, looks like from your explanation that fatty liver is the beginning of the problem. And if undiagnosed or undetected or untreated, it could go on to become something much larger and may lead to several other diseases or several other issues. Can you talk about that? Can you tell us what are the risk factors?
For example, if anybody having the non-alcoholic fatty liver disease is mostly very benign, and sometimes due to some of the risk factors, there will be inflammation in the liver, which leads to the increased transaminase levels. And when you do the liver function test, there will be increased accumulation of the SGOT, SGPT levels, and sometimes the patient will develop a jaundice also because of this inflammation. This stage is called NASH, that means non-alcoholic steatohepatitis. If there is continuous inflammation is there will be damage and scarring of the liver tissue occurs. In some of the people, there will be severe damage in the liver, and finally the patient may land up in the cirrhosis of the liver, or finally the patient may land up in the liver cell failure. This is the stage from non-alcoholic fatty liver disease into NASH, that is non-alcoholic fatty steatohepatitis, and finally the patient may land up in the cirrhosis or cell failure condition. There are so many risk factors in which patient these develop. Not all the patients will develop NASH or final cirrhosis or liver cell failure. Only people who are old age people, only who are obese and who are having diabetes, these are very high risk people. These may turn into the serious issues.
So doctor, fatty liver, as the name suggests, is all about the liver. Now this particular disease, will it lead to other conditions or diseases in the body, or will stay with the liver?
Actually, the pathogenesis of this fatty liver condition is related to the insulin resistance. So, because in those patients, these are more prone for other diseases like cardiovascular disease, number 1. Number 2, the patient may develop chronic kidney disease. Number 3, colorectal cancer. These are the common conditions the patients may prone, because everything turn around the insulin resistance only.
Doctor, if it is benign and there are no obvious signs of it, then how does one know that one could be heading towards fatty liver? Basically, what are the symptoms that one should look out for?
Yeah, this non-alcoholic fatty liver disease doesn't have any symptoms. Mostly they are benign. They generally have the complaint of fatigue and malaise and some right upper quadrant abdominal pain, because of sometimes the liver is enlarged. There will be dragging pain or some discomfort will be there. That is the mostly common symptoms. And for example, if there is NAFLD turns into the NASH, that is called non-alcoholic steatohepatitis. In those conditions, the patient will have nausea, loss of appetite, vomiting sensation, sometimes itching of the skin, jaundice, muscle weakness. They will develop all these symptoms. For example, if the patient develop from NASH to the cirrhosis of the liver, the patient develop all the symptoms of the cirrhosis of the liver. Cirrhosis of the liver symptoms commonly the splenomegaly and ascites. That means accumulation of the liquid fluid and abdominal distension due to the accumulation of the fluid. Sometimes patient may develop blood vomitings, hematemesis or hematochezia, blood through the stools. These are the symptoms related to that cirrhosis of the liver. Sometimes the patient may develop hepatic encephalopathy. That means a patient is having altered sensorium, drowsiness, hand tremors, and sometimes the people in the final stages may go into coma and land up into final death. These are the complications develop from the non-alcoholic fatty liver to NASH, NASH to a cirrhosis of the liver followed by the failure.
It's time for a short break on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG హాస్పిటల్స్. ప్రముఖ సామాజికవేత్త, సంఘ సంస్కర్త శ్రీ దండు శివరామరాజు, చైర్మన్ అండ్ మేనేజింగ్ డైరెక్టర్, మరియు శ్రీ డివిఎస్ సోమరాజు, ఎగ్జిక్యూటివ్ డైరెక్టర్ గారిచే స్థాపించబడిన SLG హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133399500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678. తెలంగాణ మరియు ఆంధ్ర ఆరోగ్యశ్రీ సౌకర్యం కలదు.
Welcome back to SLG Hello Doctor. We are in conversation with Dr. Anil Kumar Namburi, Senior Consultant Physician at SLG Hospitals, Hyderabad, and we are talking to him about non-alcoholic fatty liver disease. So doctor, what are the diagnostic tests that are available nowadays to detect fatty liver? And can some tests be done in advance to detect fatty liver, as in to take preventive measures?
As I said that the fatty liver is benign, they do have symptoms, cannot diagnose anything at any point of time. Only we are doing some screening or patients who are coming regular annual health checkups, we may suddenly incidentally find this fatty liver. For example, the main thing is the people who are more than 40 years, it's not related to this, but the people who are having risk factors mainly, that means who are having obesity or hyper cholesterol levels or having diabetes or thin people who are having insulin resistance. If we do the screening tests of the ultrasound abdomen, you can know the accumulation of the fat in this liver. There will be 3 stages will be there according to the radiology ultrasound. There will be stage 1, stage 2, stage 3 will be there. Stage 1 is the mild starting stage of the accumulation of the fat. Stage 2 is somewhat moderate. Stage 3 is very severe. So we can detect only from the routine screening only we can detect, but not other things because it don't have any symptoms. So other tests we can do is the CT abdomen or MRI scan. And the gold standard test for the diagnosis is the liver biopsy. We generally won't do that liver biopsy. Only in very few cases only we can do.
Doctor, is it at all possible to reverse fatty liver? And what are the treatment options available in case there is a possibility of reversing it? And are these treatment options invasive or non-invasive?
Definitely we can reverse the fatty liver disease through the major issues like number 1 is the weight loss, number 2 is the dietary management, number 3 is the exercise. These are the main things. If you lost the weight about 10% of your body weight, then there will be definitely dramatic improvement in the fatty liver, number one. So you have to lose your weight very gradually, about 0.5 to 1 kg per week only, but don't lose your weight too much fast. If you lose your weight too much fast, there will be reverse fat accumulation in the liver also. This is one of the risk is there. So number two, coming to the exercise, whether you do the strenuous exercise or whether you do the aerobic exercise, anything is okay. Aerobic exercise is very good, or along with that you can do that weight lifting, all these things will also work. The main program is the decrease your body weight and decrease your abdominal fat. Number three is the dietary management. Dietary management can be done by the Mediterranean diet. In all these things, how can you reduce your weight loss? There are two ways of reducing the weight loss. Number one is the intermittent fasting. Number two is the keto diet management.
Doctor, as I can see, it's all very non-invasive, and with a little bit of lifestyle management and diet management, we can overcome this problem of fatty liver. So now, will you tell us what kind of a diet will help people prevent or reduce the incidence of fatty liver in the body?
Fatty liver can be well managed with mainly the Mediterranean diet. Mediterranean diet is nothing but the plenty of vegetables, fruits, nuts and legumes, and little bit dairy and some amounts of fish. That is the main theme of this Mediterranean diet. And daily you take coffee about 3 cups per day. It will definitely reduce your fatty liver. And the most important thing is choline consumption. Choline consumption is, the choline is mainly dealt by the liver only. So it's very important. If you have less choline levels, there will be increased chances of the fatty liver accumulation. So the foods which contain high choline levels, which can be dealt with the liver, should be taken. That means mostly these are the vegetables and fish and eggs. These are the 3 components which are rich in choline. You have to take these type of foods. This fatty liver is also related to the low potassium levels. In patients with a low potassium level, there will be increased accumulation of this fatty liver by the scientific studies. So you have to take food content that is rich in potassium, like banana, sweet potato and broccoli, or kiwi fruits. There are some studies in which the vitamin D deficiency are also more associated with this fatty liver. So we have to correct that vitamin D deficiency levels. One of the most important vitamin is vitamin E. It is more important in patients who are NASH, that means non-alcoholic steatohepatitis. If there is a liver inflammation, to control that liver inflammation, vitamin E 800 units per day is required.
Doctor, we have understood what to have if one has fatty liver disease. But what are the foods and fruits especially that you mentioned that one should not have when one is suffering from fatty liver disease?
Yeah, in fatty liver disease people, cool drink consumption is strictly avoided, point number one. And some of the people are taking sweeteners because they will have low sweet, they can be used. Even the diabetic patients are also using that sweeteners. They should be completely avoided because they will increase that fructose in the body. Only that fructose is mainly dealt by the liver only. So it should be completely avoided. And other things like whey protein powder or some soya protein isolate should be completely avoided. And vegetable fats are also completely avoided.
Doctor, now that we have understood that it's mainly the diet and the lifestyle that can lead to fatty liver disease, I want to ask you, can children also develop it? And what could be the causes?
Yeah, actually it is the middle-aged people disease, but even though children will also develop this fatty liver, 1 in 10 of the children who are obese, number one, who are obese and who are having high cholesterol levels, that means hypertriglyceridemia, high triglyceride levels, high LDL levels, are more prone for developing these things. So in those people, the treatment will be the same, reducing the weight and diet control. This is the main thing. Kids reduce his weight, automatically the fatty liver will be controlled. It should be done with mainly by the exercise and diet control.
Highly obliged, Dr. Anil, for sitting here and patiently explaining to us all about NAFLD. Can you give us some parting advice, especially with regard to a good diet schedule or diet plan that can avoid the onset of fatty liver disease?
Number one is decreased caloric intake. That is the most important thing. So there are 3 types of nutrients are available. Number one is the carbohydrate, number 2 is the fat, the protein diet. Basically, the body mainly requires the fat and the protein diet, but only 50% of our dietary requirements should be taken from the carbohydrate. Actually, what we do generally is 80 to 70% from the carbohydrates and less from the proteins and fat. So we have to first you have to cut down your carbohydrate, number one. That is the most important. Once you cut down the carbohydrate, there will be less secretion of the insulin in your body. So automatically the patient may not develop the insulin resistance. If you take more high glucose contents in the body, there will be chance of high insulin development, high insulin release from the pancreas, and there will be chance of insulin resistance development in the later stages. So first cut down your carbohydrate so that you will cut down the insulin release levels from the pancreas. Automatically increase your fat content, most of the protein content. So you have to increase the protein and fat content for these things. So one more thing what you do is the intermittent fasting, that is most commonly popularly known nowadays. So it is actually there behind the long so many years. The intermittent fasting is very simple. You should not eat at night times. You should eat only in the daytimes. So you should not eat after 6 o'clock or 7 o'clock. That is the main thing. So after 6 o'clock you have to continuously take only the normal water only. So from 6 o'clock or 7 o'clock after completing your dinner, you have to fast for about 14 to 16 hours. That means maybe around up to 9 o'clock or 9:30 next day morning. So after 9:30 or 9 o'clock, you have to do your breakfast. That is should be taken only in the small quantity of the food. So after the breakfast, you have to wait for about 4 hours. So 4 hours to your lunch. Then you take the meals which contains proteins, mixing of the vegetables and fat and less carbohydrate. That is the main theme. And the milk dairy products should be less. That is the main thing. So you eat all these components at this lunch time, and you take again a break of about 4 hours or 5 hours maximum. That comes to evening 6 o'clock or 5:30 or 6:30 or whatever the time. It will be there 7 o'clock. So again you take the dinner, which should be very minimal quantity of the carbohydrate. In the night time, we utilize less energy, we are less active, we are in the sleeping mode. So there is no need of taking any carbohydrate mostly during the dinner time. So there will be fasting hours of 14 to 16 hours. Sometimes you can skip the breakfast also. Some people who don't have an acidity problem, they can skip the breakfast and they can do directly 2 meals. That means meal at around 10 o'clock or 10:30 and another meal at around 4 or 5 o'clock. So they will have 2 meals. So there will be a fasting time of about 16 hours, 17 hours, 18 hours like that they will arrange. Because of this intermittent fasting and less caloric intake, less carbohydrate intake, the people may not develop the insulin resistance. So they may not develop the fatty liver. If already people who are having the non-alcoholic fatty liver, it may reverse and it will come to the stage 3 to stage 2, stage 2 to stage 1 and without fatty liver in the body. And other important points is it will definitely reduce your cholesterol levels, it will definitely reduce your blood pressure levels, definitely reduce your glucose levels also. Automatically your diabetes will be under control, BP will be under control, and the cholesterol level will be under control. There will be diminished fat in the liver from 3 to 1, or sometimes it may land up in the 0. So this is the main theme of this intermittent fasting. And one more thing I want to explain this point of view, the people who are obese, having high abdominal fat, these can do the keto diet. Keto diet is good for these patients who are obese. They can reduce the weight, and this has a very dramatic effects. But keto diet cannot be done continuously, but it can be done partially to reduce your body weight to some duration only. This will reduce your fat automatically. It will reduce your insulin resistance automatically. BP control, sugar control, or the cholesterol control will occur. These are the 2 things. Keto diet and intermittent fasting are very good for controlling these things.
Thank you so much, doctor, for answering all our queries on non-alcoholic fatty liver disease. Thank you so much for joining.
Thank you very much.
Viewers, we'll be back with you soon with yet another health-related conversation. Until then, take care of yourselves and your dear ones. And yes, keep that mask on. Viewers, hope you've hit the bell icon and are following all that's happening on SLG Hello Doctor. If not, do it right away.